Welcome back into Salam Media. And this is Mid Morning Talk with me, your host, Maria Mia. And I've got on the line a neurosurgeon specializing in medico-legal practice, and that is Dr. Herman Edeling. And we're going to be discussing SA's vaccine strategy and the health and economic crisis brought on by COVID-19. And hopefully, through the doctor's experience and expertise in research, he'll be able to answer some of the questions that many people in South Africa are still grappling with or trying to make sense in terms of uh, everything from vaccination, in terms of to even just the PCR test, to the way forward, to treatments, to even how side effects of vaccines, how are they being recorded, even uh, those that have been vaccinated and then sadly have passed on, how are those deaths being recorded? So Dr. Herman, Dr. Herman had indeed written an open letter to our president, Cyril Ramaphosa, as well. And I think perhaps let me start with parts of that letter that it was penned on the 10th of August 2020 to the President of the Republic of South Africa. And it goes on to say, Dear Mr. President, we approach you in the spirit of Tuma Mina, in full confidence that you have the interests, livelihoods, health, and lives of all South Africans at heart. In this open letter, we address you specifically in regard to the safe and effective means of prevention and treatment of COVID 19. The new long walk to freedom will restore human health and dignity that will restore human health and dignity must begin now. The road leading to happy, successful individuals, families, and communities may be challenging, but will be rewarding. To achieve this, you, Mr. President, will have to take hard and unpopular decisions now to realize that the people of South Africa, from medical authoritarianism, economic hardship, and avoidable illness and death. So that is part of the letter introduction, and then Dr. Herman sets out his concerns, which we will be discussing um, along his way in the form of questions that I will be speaking to him. And then recently, I read an article that doctor spoke about in terms of his particular interest and the insights into the fundamental flaw of mass vaccination during a pandemic and those deaths which occur during the period of immune suppression which follows vaccination. And he says they are medically vaccine deaths and must be recorded as such. So let me welcome Doctor to the program, and we will then discuss the letter, the contents of the letter thereof as we go along. So, welcome to Salam Media, Dr. Herman Edeling.
Thank you very much, Miriam.
So, as I've mentioned in your introduction, you are a neurosurgeon.
Yes, I am.
And are you still in practice as a neurosurgeon?
Yes, although in restricted practice. I conducted general neurosurgical practice until 2008.
Mm-hmm.
In 2008, I stopped operating. And since that time, I've been restricting my practice to medico-legal neurosurgery. In other words, preparing reports for people who have suffered permanent disability due to injuries to the nervous system, and also in relation to allegations of clinical negligence by neurosurgeons or spinal surgeons, and then obviously giving evidence in court when necessary. And more recently, I've become trained in mediation of disputes, and I've been involved in leading the development of mediation of medical disputes as opposed to litigation of medical disputes.
Okay, so basically trying to find, so basically like an ombudsman instead of going to litigation, more like sort of like an ombudsman. I'm just trying to understand.
No, not like an ombudsman. In mediation, the mediator gets the two parties together and gets them to talk to one another. And the mediator guides them through a sensible, polite, respectful conversation dealing with the facts and dealing with the law and dealing with medical science until they come to a common understanding and then the parties agree on a solution. So in mediation, the power to find the solution is with the parties, not with the mediator. The mediator simply provides a safe and conducive environment in which they can talk freely and where that which they say in the mediation cannot be used against them later in court or because it's a completely confidential process. And it has an amazing power to allow people to find their own solution.
Thank you. Doctor, so tell me what compelled you, what propelled you to write this open letter to our president in August, because I'm sure there must have been many debates and circumstances and that leading up to why that warranted you to address the president and write this open letter. So what we're going to do is I'm going to allow you time to reflect on your response. We're going to take a short break, and when we get back, you can then discuss the circumstances that led you to write this open letter to the president.
Okay.
Emergency Medical Depot, conveniently situated in the Duzimed Medical Center, corner Burger and Boshoff Street, Pietermaritzburg. We provide safe, affordable, and convenient medical facilities, open till 10 p.m. every day of the year. We have a full-house clinic that operates from 2 p.m. to 7 p.m., which is run by a qualified sister. The clinic offers immunization, vaccination, wellness, general consultation, and more. Call Duzimed Medicine Depot on 033 3421 Duzimed Medicine Depot, your pharmacy of choice.
Durban, KwaZulu-Natal has been the hardest hit by the recent civil unrest. Hundreds of supermarkets, factories and warehouses have been looted and destroyed. Thousands have lost their jobs and are in need of food and household supplies. Penny Appeal South Africa is currently on the ground working with communities to provide essential items to those severely affected. Donate toward the Penny Appeal Hardship Fund today and assist us in caring for families for a 3-month period with essentials and assistance to small businesses affected by the devastating effects of the unrest. Help us help our city. www.pennyappeal.org.za or call 031 11 00 573. Penny Appeal. Small change, big difference.
What makes Randery Jewelers the optimum place for your memorable gift? Is it our range of exclusive, high-end, luxurious jewellery? Or is it our master craftsmanship of all your bespoke jewellery needs? We believe it's because at Randery Jewelers, we know just how to make your special moments last forever. Whether it's for a wedding, anniversary, or just a simple gift to show your love, trust Randery Jewelers to make it special. www.randeryjewelers.com. Make your moments last forever with Randery Jewelers, the family name you can trust.
Osman's Taj Mahal Spice and Rice. For over 80 years, Osman's Taj Mahal have been perfecting the art of the perfect blend of spices, pure, aromatic, and well-seasoned. Spices to tantalize your taste buds. From creative cuisines to gastronomical gourmet goodies. From exotic odors to traditional dishes, Osman's Taj Mahal have remained synonymous with quality spices and condiments. Taj Mahal rice, beans, and lentils. Try our range of chili bite mixes, rose and ilachi syrup, our quick and easy biryani pack, and our traditional range of spice blends. Osman's Taj Mahal. There is no substitute for quality.
Africa. For your convenience, the Africa Muslims Agency's Durban office has moved to 797 Jan Smuts Highway, Sherwood, Durban. Our friendly staff are eagerly awaiting to receive, advise, and share with you the current ongoing campaigns and projects that you have been supporting for the last 35 years. Visit us at 797 Jan Smuts Highway, Sherwood, or call 031 207 5676. Africa Muslims Agency, inspiring the spirit of giving.
Rejuvenating media day by day. This is Salam Media.
Welcome back. You tuned into Salam Media, and with me joining, I have Dr. Herman Edeling, and we're discussing South Africa's vaccine strategy. And before the break, I asked Doctor the question in terms of what compelled him to write an open letter to the president, and we're awaiting Doctor's response.
Thank you, Miriam. What compelled me was my allegiance to my Hippocratic oath. When I graduated in medicine in 1975, I took a Hippocratic oath. I have lived by that oath since that time. And that oath, amongst others, means I took on myself the duty to act in the best interest of my patients, not only of my patients, but also that whatever I do must be good for the health of the community at large. I also took an oath not to give any poison or harmful substance to anybody. And I also took an oath to share any knowledge I have about medical treatment that is beneficial to the health of people, to share it with my colleagues. And reflecting back on that oath, I had come to realize with the passage of time, more and more, since the COVID-19 pandemic and everything that went with that, I came to realize that there were serious problems and there was disinformation. And because I understood certain things that I was reading and seeing, I felt it was my duty to my Hippocratic oath to speak out.
Okay. So there are a number of things we'd like your medical opinion on and your professional opinion on. So let's just focus on the vaccines itself and the concerns regarding the mRNA type of vaccines, which you say in current use are now scientifically linked to raising breakthrough infections, hospitalizations, and deaths. You quote COVID statistics in Iceland, the Israeli breakthrough study infections. In fact, the cure may become worse than the illness despite being denied by officials and mainstream media. This news is spread via social media and is one of the leading reasons for vaccine hesitancy. So can we just focus, because there are many, that's true, in South Africa now, many people are hesitant because they aren't sure, they feel they don't have enough information to make an informed decision to be vaccinated. Yet we see whenever there's healthy discussion regarding vaccines, mainstream, it's shot out in mainstream media. You have those that are advisors to the president in the command center, saying things like, where when the discussion with ivermectin went on, Professor Mahdi was stated to say, do yourself rather take that money and buy yourself KFC, and it was dismissed for that without proper a response, a medical response. I read in the media when Professor Tim Noak said we need to have more academic discussions, medical discussions regarding the effectiveness of the vaccine as well as the safety. Then he was labeled as he must get a refund from his fees for medical study and things like that. So why, there's so many trading of insults in the medical field. I've never witnessed a thing. I've always seen healthy academic discussion with various issues which increase our body of knowledge and our understanding of whatever it was. Why suddenly when it comes to COVID, there's only this one way thinking, as well as anybody that wants to contribute anything else, they are like shut down and they are discredited.
Thank you, Miriam. Of course, you've asked me about 23 questions now. I didn't count. So I will answer what I think. If I miss out something important, you'll bring me back to that. You know, Miriam, early in July, before I wrote the letter to the president, I wrote a document because of my difficulty trying to make sense of what was going on. And it was exactly the thing that you are talking about now, where there are differences of opinion and people are insulting one another. The document I wrote is called COVID-19 Blind Faith or Open Minds, Critical Thinking in Times of Crisis. That letter is referenced in my letter, or that document is referenced in my letter to the president, and there's a live link, so anybody who sees the letter to the president can open that blind faith document. It is linked at paragraph 2.1.3 of the letter to the president. Anyway, in that, I started with the question, have I gone mad or has the world gone mad? How is it that in addition to fear of the pandemic and economic hardship due to lockdown, we now seem to live in a world of rampant confusion? We are subjected to diametrically opposed opinions, all strongly expressed by individuals who are regarded as experts. And then I went on to analyze which experts I was aware of through media, etc., and through social media. And I found that they could be divided into two groups. And these are described as follows. On the one hand, we have the fashionable opinions. Now, these fashionable opinions are generally propagated by politicians and by experts who are appointed by politicians, and by institutions that we have traditionally trusted, and by pharmaceutical companies, and by the mainstream media and celebrities. And it was also apparent to me that many who propagate these fashionable opinions are well funded, either funded by governments or funded by the pharmaceutical industry. And it is those experts and politicians and celebrities who express these fashionable opinions that say insulting things about those who disagree with them. So we have ad hominem attacks instead of the normal professional and scientific method of discussing the issues at stake and discussing facts and science and reason and talking about why one does or doesn't agree with somebody else. We keep on hearing assaults on the integrity and character of people who disagree with these fashionable opinions. The other characteristic of the fashionable opinions is that they are expressed as authoritarian opinions. So the WHO, the CDC, the FDA, in South Africa, SAPRA, the President, the Coronavirus Command Council, universities, all express opinions in an authoritarian way, telling us what is and what we must do. I've not heard these fashionable authoritarian opinions being motivated or explained by reasons. Now, on the other hand, one has what you can call the unfashionable opinions. And these are generally propagated by independent experts. So they don't work for the government and they don't work for the pharmaceutical industry. They are independent. And apart from experts, there are also other concerned individuals. They go out on a limb on their own time and their own dime. And these independent experts and other voices are almost automatically vilified and censored. So without going into what's behind it or trying to read the minds of those who do this or that, it is quite apparent. And since I wrote this, which was in July 2021, everything I've seen since then has remained true to this division. So I think that answers my perspective on the two groups. I have not witnessed people who express unfashionable opinions vilifying and insulting those who express fashionable opinions. What I have heard from them is reference to facts, reference to statistics, reference to studies, open-minded, rational explanations of why they hold their views. I've not heard from the authoritarian exponents of the fashionable opinions and instructions that same kind of transparency in explaining the facts and the reasons for their opinions.
Dr. Herman, can we now go specifically into this type of vaccine, the mRNA vaccine,
Yes.
and also, in your professional opinion, your concerns regarding this vaccine as well as its safety? So can we just understand this in your opinion in terms of this type of vaccine and the rollout of this type of vaccine?
All right. I will gloss over this briefly. You can ask me for more detail if you wish. First of all, they should never have been called vaccines because they really are not vaccines. Vaccines like the flu vaccine and measles and mumps vaccines, rubella vaccine, polio vaccine that we've always known, are dead or attenuated organisms which are injected into a person. They remain where they're injected, and the body recognizes the foreign protein and develops an immune response over time. These are a completely different thing. They do have some elements in common with vaccines. In other words, what they have in common is that they are injected into the person. The other thing they have in common is that they are intended to protect people from the disease. So it would be correct to say that these are injections whose purpose is to protect people from a specific disease. But what they don't have in common with vaccines, whereas vaccines give immunity, these do not give immunity. And even the manufacturers of these mRNA so-called vaccines do not even claim that they give immunity. Immunity means you're protected from contracting the disease. You are protected from carrying the pathogen, and you are protected from transmitting the pathogen to other people. Now, we know that that is not claimed by the manufacturers of these vaccines, or these so-called vaccines. And we also know in practice, since the rollout of these injection programs, that they do not offer protection to contracting, carrying, or transmitting the virus. So that is a very important shortcoming that they have. It is only claimed that they provide protection from severe illness and death. Now, I believe they do provide protection from severe illness and death, but it is important to understand the time frame, because from the moment that one is injected, there will be a period of maybe 10 days, 2 weeks, maybe 3 weeks of immune suppression, where the body's response to the injection is to suppress the immune system. And during that initial period of immune suppression, one is more susceptible to the COVID virus. And not only the COVID virus, also other conditions such as cancer and other bacteria and other viruses. And there is very good evidence that immune suppression is a reality, and that many people have contracted COVID and died during that initial post-vaccination period of immune suppression. For those people who survive that period, and which is the majority, they will then get a period of protection where they won't be protected from catching, carrying, or transmitting the virus, but they will be protected from severe disease and death. Unfortunately, it now transpires that that period of protection starts to wear off after a number of months. And by 6 months, the protection is much less than it was after 1 month. And that is where this crazy notion has come from, to give booster vaccinations every 6 months. So the duration of protection is not for the rest of your life. It only kicks in a few weeks after the injection, and it only lasts for a number of months, and then it wanes. So that is what has been found. The other thing that is important to understand is that the mechanism of this vaccine is totally different from traditional oral vaccines, in that it is a genetic intervention. The vaccine is genetic material that is injected into your body in a lipid nanocapsule. That's a little bit of fat that protects it from degradation. In that lipid nanoparticle, it distributes through the body and it enters various cells of your body. Once inside the cell, the messenger RNA becomes active or free from the nanoparticle, and it then instructs your cell to produce coronavirus spike protein. So in effect, the so-called vaccinated person becomes a factory for coronavirus spike protein. Now that spike protein is the pathogen. That is the poison. That is the thing that makes one sick. So you are producing the pathogen inside your body. Now the theory is that once that is produced in your body, your immune system will recognize it and you will develop immunity to it. and that is all very well and good. But there are problems with that theory. The natural way that people develop immunity to viruses and bacteria is they enter through the nose or the mouth. They are trapped in the nasal mucosa, and the body develops an immune response there. Or with a vaccine, it's a finite amount of weak or dead material that is injected into your body. It stays there and you develop immunity. But with this mechanism, there is a sudden gush of spike protein into your circulation from many different cells in the body. So your immune system is suddenly confronted with spike protein, which is a pathogen, in your blood. That is not the way it is accustomed to work. Now, when I could not predict whether it would work better or worse, I could just say that it's different. What I have understood from vaccinologists and immunologists, scientists who understand this process, is that because of this rapid and unusual method of confrontation, one develops antibodies, but the important components of immunity, which are to develop B cells and T cells, does not occur or does not occur so well. Now, immunity with antibodies but without the backup of B cells and T cells is not nearly as good as proper immunity, which the body develops after natural infection. Now, in the experiments that were done before the emergency use authorization was provided, the manufacturers did this, and true to expectation, when they tested the blood, they could identify antibodies to the spike protein. So, marvelous, it works in its primary objective of producing antibodies. But when it comes into practice, we have the initial problem of the immune suppression, so the delayed onset of protection. The second problem that these antibodies don't seem to prevent one from catching or carrying or transmitting the virus. They only protect you from severe illness and death. And after a while, they go away and your protection is gone, because long-term immunity is dependent on the memory cells that remember the antigen. So the problems were predictable. I heard last year these problems predicted by scientific experts in immunology and vaccinology. And now one can see the evidence. One sees the evidence, for example, in a very good study done by Dr. Bashir in Namibia, which I can show you, I can share it with you if necessary, where he studied 91 countries around the world according to their reports of week by week COVID cases and COVID deaths. In each of the 91 countries, there was a surge in COVID cases and a surge in COVID deaths immediately following the rollout of vaccination in those countries. Now, that pattern of post-vaccination surge in COVID cases and COVID deaths is entirely consistent with the concept of immune suppression for 2 weeks or so. So that during that time, more people get COVID and more people die from COVID. Followed a few weeks later by, again, protection so that the numbers go down. Now, I must say, I wouldn't like to be protected against something which is going to give me for a few weeks a higher risk of dying from it. And then after a few months, my protection will go away. But also, I will never have protection against catching it. So I've always got to be careful of somebody with COVID coming into proximity with me. And I also am not protected from giving it to anybody else. So I don't see the purpose of having the vaccine except for the fairly narrow purpose of protecting myself from severe illness and death for a period of a few months. Now, a rational person who can think clearly, anybody with common sense would understand that that potential benefit, which is a benefit, must be weighed up against the risks of the vaccine. Now, I haven't spoken at all yet, Miriam, about the risk of the vaccine, But perhaps we should pause there.
I think so. So let's go for a short break. When we get back, let's speak about the risk of the vaccine. Please hold the line. We'll be back shortly.
Thank you.
The blessings of charity are the ideal means to avoid calamity and despair. The Al Imdad Foundation gives you the opportunity to sponsor a share in a borehole in South Africa for just 1,000 Rand and provide what the Holy Prophet, peace be upon him, called the best form of charity. Donate online at alimdad.com or call 0861 786 243 for more information.
Looking to get your kick? Kiki's have now reopened on 235 Matthews Maiwa Road in Durban. Head on over for the Taste with Kick. We offer something scrumptious for everyone in the family. Wraps, chicken tikka, burgers, tender grills, mocktails, milkshakes, and so much more. Corporate and events catering available. Visit our social media pages for more info or call 031 209 0119. Kiki's, the Taste with Kick.
The two major dams for the Eastern Cape's biggest metro, Nelson Mandela Bay, are running dry with no major rain forecast. The city of Port Elizabeth is facing an unprecedented water crisis, home to an estimated 1.3 million people. The Al Fida Foundation needs your support to deliver water to impoverished areas. Support our water drive and help us raise monies for water delivery vehicles to ensure water distribution in areas of critical need. Donate your lilla to the Al Fida Foundation. Visit our website at www.alfida.co.za or contact us at 041 484 1288.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042 203 1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
From the townships of South Africa, the refugee camps in Syria, or orphanages in Yemen, the eyes of the needy speak volumes with just one glare. We know what it's like to be at ground zero, with food essentials, clothing and blankets, fresh water portal trucks, and even on-site navigators. We use every cent to better their tomorrow. Become part of our journey to bring relief to all. Go to www.ashrafulaid.org or call us on 011-809-8181. Ashraful Aid, under the auspices of Maulana Suhail Wadi.
What makes Randery Jewelers the optimum place for your memorable gift? Is it our range of exclusive, high-end, luxurious jewellery? Or is it our master craftsmanship of all your bespoke jewellery needs? We believe it's because at Randery Jewelers, we know just how to make your special moments last forever. Whether it's for a wedding, anniversary, or just a simple gift to show your love, trust Randery Jewelers to make it special. www.randeryjewelers.com. Make your moments last forever with Randery Jewelers, the family name you can trust.
Salam Media, a global voice for humanity.
Welcome back. You tuned into Mid Morning Talk with Mariam Mia. Yes, and it's just gone early afternoon. And I'm speaking to a neurosurgeon specializing in medical legal practice, and that is Dr. Herman Edeling. And yes, we were discussing the vaccine, and now we are going to be focusing. So Dr. Herman just gave us insight and understanding in to the current vaccine and how your body how your body sees the how your body sees it and makes sense of it in terms of it's not the traditional vaccine. Is in fact he hesitates to call it a vaccine in the traditional sense of the word as well, in terms of because it sends a signal that for us to produce proteins of the antibodies for the COVID virus. But now we're going to be focusing on the concerns and side effects of this so-called vaccine, as Dr. Herman Edeling has put it.
Thank you, Miriam.
I'm just trying to understand. I'm not a medical person. My aptitude is more in the arts section, so and way. So I'm just trying to understand what we said. But obviously, as you've said, it's not like the vaccines that we were immunized for in terms of our smallpox vaccines when we were little, or those booster vaccines, or those types of vaccines, or even the flu vaccine per se that we normally take before the onset of winter. This is different technology in terms of this messenger RNA vaccine.
That is the important point, Miriam. It is new technology. And when new technology is used in live human beings, it should be properly tested before it is used. Theoretically, it may make very good sense. And I'm sure the developers of this had very good intentions when they were developing it. But before you can give it to human beings, you have to be sure that it's safe, and then you have to be sure that it's effective.
So, Dr. Herman, you are quoted in business to say that at the same time you are cautious, but you're also excited. So I just want to put that out there, that you are excited because if it works, you believe it would be an amazing scientific breakthrough that would be good for humanity and possibly could be used in other things and infections such as cancer and other diseases. So
Yes.
you actually looking forward to it as a very interesting scientific breakthrough. And I think, like everybody, you want this to succeed, but at the same time, we have to be optimistically cautious because it's too soon to tell. The effects of it are not known. I just wanted to put this in perspective because you, like many other colleagues in the medical fraternity, are rooting for the vaccine to work because scientifically it will increase our body of knowledge, and hopefully this will lead to a way of cures for other illnesses and diseases as well. So I just wanted to also just put that out there as well.
Yes, no, that is 100% correct, Miriam. If this breakthrough technology is perfected, it will be very good. Now, the thing is, when any new medical device or medical procedure or medical intervention is tested, there are standard steps that it has to go through before it can be approved as being safe for use in human beings. The first is animal trials. If a new invention passes successfully through animal trials, in other words, the effectiveness and the safety are successful, then it can go into phase 1 human trials. If that is successful, it can go into phase 2 and then phase 3 human trials. And it is only after successful phase 3 human trials that a medication or an intervention can be approved by the regulatory authorities for general use in people and for prescription by doctors. Now, in the case of this mRNA vaccine, because of the emergency that resulted from the WHO declaring COVID a pandemic, and all the governments declared that there were now states of disaster, the regulatory authorities were allowed to bypass that standard progression. But that doesn't take away from the fact that the phase 3 trials of this mRNA vaccine will only be concluded in about 2023. So it is only then, irrespective of any authorization that is given, any instruction, any authority that is employed, we will only know in 2023 what the short and medium term efficacy and safety of these interventions are. We will still not know the long term safety and efficacy, where there may still also be risks. But certainly at this stage, one doesn't know. And that is why anybody who now says or proclaims these vaccines are safe or these vaccines are effective does not know what they're talking about, because the knowledge that is necessary to make those claims cannot be available until 2023. Now, however, in the absence of the necessary knowledge, there are early signals, because since the vaccines have been given, there has been a certain amount of experience. And this is all early experience, so it is short-term experience. And the short-term experience is this, that there have been more deaths and more severe complications from this vaccine than for any previous vaccines. In fact, not only any previous single vaccine, but more than all vaccines put together. So when the early signal is this is more dangerous than previous vaccines, I would expect a responsible health authority to say, no, let's stop this first. Let us first stop this rollout. Let us study this better. Let's go back to the manufacturers. Let's ask them to get their scientists to put more research and development into this, because they must be able to tell us why are more people getting sick and why are more people dying. Now, there is at this stage, at this early stage, there is a wealth of evidence of markedly increased risk of death and severe illness following the vaccine than with any other vaccine. And I can show you that evidence. This, unfortunately, is a radio show, so I cannot show you graphs or pictures on the show, but there is a wealth of evidence. What I've done, Miriam, I've put into the chat function of this meeting, I've put a link to a website. It is my website, and if you follow that link, you will get to a page that houses a number of interesting documents. So if one looks through the documents that are accessible on that page, one will see. And the particular documents that give insight into the risks and adverse events of COVID are the document that is entitled Unprotected Mass Vaccination Triggers COVID-19 Waves Worldwide. That is a study that shows in 91 countries surges of deaths and cases following the rollout of vaccines. The other document, Vaccination versus COVID Morbidity Mortality Correlation Countries in a Different Way, shows the same kind of data. The other very interesting document is a VAERS presentation, by an actuary by the name of Gwetsko, which shows that in the first portion of 2021, more or less until a date in July, as far as I know, there were 24 times more deaths reported per 100,000 vaccine doses than the previous annual average for all vaccines combined. So whatever the rate of deaths per 100,000 vaccine doses in the previous year since 1991, in the first little bit more than a half of 2021, the reported deaths were 24 times that. In other words, the risk of death from COVID-19 mRNA so-called vaccines is more than 24 times the risk of death from other vaccines combined.
Dr. Herman, do you think that the current platform in terms of reporting side effects from while taking a vaccine is sufficient? And, I'm just thinking of normal clinical trials in that, in terms of this, even if there's a slight cough, you need to report it. When you have your clinical groups, whatever happens to you in terms of your body, it's it's recorded. It's meticulously recorded. It's looked into if there's a causal effect of what you're experiencing before you took a medication or a vaccination or new drug testing. Why has this rigor and meticulousness not being reported now? So even if the world is now in the largest a global experiment, but in terms of how we're reporting data for side effects of experiences, why isn't there maybe a global platform, a good platform? We have the technology to support such reporting. Why is this not done in your opinion, in terms of how we report vaccine side effects?
That is an extremely good point, Miriam, and I agree with you entirely. This reporting system that I've referred to is VAERS. It's a voluntary reporting system. So this is the system of the American CDC, where people can voluntarily report. But it is very well known that any voluntary reporting system is underreported. For example, I think in South Africa, it is very well known that cases of gender-based violence are not fully reported to the police authorities because people don't like reporting. And so the number that are reported is only a portion of the real number of that problem. There have been various estimates that the true number is anything from 100 times the reported number to 25 times the reported number. But even if the reported number is the correct number, it's still a frightening number. Now, because of exactly what you are saying, this was one of my most important requests to President Ramaphosa. It is set out in paragraph 2.1.6 of the letter to the President, where I asked the President to do the following: track and publish daily statistics on the numbers and proportions of vaccinated individuals who A, have any serious health issue, B, have been admitted to hospital for any reason, and C, who have died for any reason, as well as D, the number of and proportion of hospitalized individuals who have been vaccinated. Now, one would imagine that any responsible health authority that is given an unproven vaccine, even if the authority really believes it's in the interest of people, but it is aware that it's unproven and it's used under emergency use authorization. Therefore, it is effectively part of the phase 2 trial. They should not just sit back and wait for voluntary reporting to VAERS. They should actively track and publish. So the organization that gives the vaccines should monitor and follow up the individuals who have been so-called vaccinated and should record everything that happens. Now, in certain countries, that happens a lot better than South Africa. So we do get every now and then statistics from the United Kingdom that show quite frightening results. We also get statistics from Israel that show quite frightening results. For example, from the United Kingdom, we get that people who are hospitalized with Delta variant COVID, who have been vaccinated, a greater proportion of them will die from their COVID than those who have Delta variant but who have not been vaccinated. So that statistic published by the UK Health Service shows that if you've been vaccinated and you catch COVID, you've got a greater chance of dying than you would have had if you were not vaccinated. In Israel and Gibraltar, by the way, Gibraltar has 99% of its population vaccinated. They've got rampant COVID epidemics in those countries. The mass vaccination has not stopped the epidemic. People are getting sick, people are in hospital, vaccinated people are in ICU and they are dying. So in those countries which do release actual valid and relevant statistics, it is evident the vaccination is not protecting the community because the epidemic keeps on going, and it's not even protecting the vaccinated from serious illness and death because they are getting very sick and they are dying. And I believe that in South Africa we should also do that. I think that everybody who's been vaccinated should be followed up actively by the Department of Health, and whatever goes wrong with their health status should be recorded. And I also believe that we as the public have the right to hear those statistics every day. So Miriam, just like we are told in the mainstream media every day how many new cases of COVID there are, how many people with COVID are hospitalized, and how many people with COVID have died, we should, and we have a right to also be told every day how many vaccinated people have got sick, how many vaccinated people have been admitted to hospital, and how many vaccinated people have died. So congratulations, Miriam. I think you hit the nail on the head.
Yes, you know, for us is you raise a point like this, but it's just that whoever brings up an issue in terms of safety, effectiveness of the vaccine, and also to help many who need more information on this. You start opening up this conversation, you verified, you are labeled an anti-vaxxer, and the debate goes on. You're being sinister, you're being unpatriotic. And these, as you say, are medical concerns. I mean, this is based on research. You have evidence here. So why are we afraid to have these conversations? Or why are people being vilified when they want to discuss this? They want to have these conversations. And also, companies are now putting employees in a spot to say, if you're not vaccinated, you might not be able, it's going to affect your employment. Or medical aids are now sending messages to their members to say, if you are not vaccinated within this time period, you will pay extra premium. So you're just being prejudiced all the time. And you're being labeled as irresponsible. So if a person who is not vaccinated, the common belief is you are more likely to infect somebody with the virus as opposed to somebody who's being vaccinated. So you're unpatriotic, you're irresponsible. There's nothing sinister in that. So I'm just trying to make sense of this. If there's a lot of concern here, why not we having healthy debates and discussion? Why is everybody vilifying? If you want to ask a question or empower yourself as an ordinary citizen who does not have this medical knowledge as a medical expert might have.
Thank you very much, Miriam. There are two aspects to your question. I'm going to deal with them separately. The first is the vilification and the unwillingness to debate properly. In my letter to the President, I asked the President to admit that science is not an institution to be proclaimed by authority. It is independent of authority. It is dependent only on free and uncensored application of the scientific method. This includes observation, questioning, research, forming hypotheses, experimentation, logical analysis, conclusion, communication with others, and replication by others. That is the scientific method, and that works. I asked the President to stop censorship of medical and scientific information and conclusions that are contrary to official policy, and to stop ad hominem attacks against those who hold opposing views, but to encourage open debate and the sharing of information and ideas in both public and private fora. So what you have again expressed, Miriam, is exactly right. I have views which are formed for whatever reasons, but they are based on my observations, facts I'm aware of, the science I understand, and rational analysis. When somebody else holds a contrary view, I respect that person's right to hold that contrary view. I approach that with a goodwill assumption that perhaps that person knows something that I don't know. And by engaging in free and open discussion with that person, I will probably benefit by learning what that person knows that I didn't know, and that will advance my understanding and my knowledge. And at the same time, I will be willing to explain to that person the reasons that I hold my view. And that is, by the way, what I've been doing for many years in courts of law, where I've given evidence as an expert witness, where I explain my opinions, where I'm cross-examined, and where my opinions are countered with those of other experts, and we engage in court in a proper discussion of the facts, the science, and the rational analysis. In that way, courts can come to a conclusion, and in that way, scientists, doctors, people can come to conclusions by open, proper debate. So this thing of saying, I'm not talking to you because you're wrong, or I'm not talking to you because you are vile, or because you're different, or there's something wrong with you. That is the end of science and the beginning of authoritarianism leading to totalitarianism. It is like when the whole world believed that the earth was flat. It was sacrilege for anybody to say that the earth was round, or to say that the earth revolves around the sun, because they were proclaimed as being against the church and against knowledge. You cannot do that in science. Now, the second part of your question, Miriam, went about
Dr.
patients.
Can we need to go for a quick break? Can we take your second part in round up after this break?
Of course.
Thank you.